Hello, and welcome to this talk on rural healthcare disparities. I'm going to be discussing some of the challenges faced by individuals living in rural communities throughout the United States. The goal of this talk is to highlight the need to improve access to and the quality of care provided to residents of these communities. I also want to provide you with some ideas regarding what you can do to help and maybe even ignite some passion within you to want to get out there and seek additional opportunities to create changes in this area. Two of the APTA public policy priorities for 2023 to 2024 include the desire to empower all people, regardless of where they are born, live, learn, work, play, worship, and age, to live in healthy and independent lives, and to be able to improve care by eliminating barriers to healthcare services. Contained within these priorities are the plan to seek opportunities to elevate the quality of care provided by PTs and PTAs to improve health outcomes for populations, community, and individuals. So why is this a problem? Why is it relevant? Well, the U.S. population is currently over 331 million individuals, and nearly 60 million of those live in rural communities. Almost 1,900 out of just 3,200 counties are considered rural or mostly rural. And when it comes to these communities, they have higher poverty rates, higher proportion of older adults, which, as we know, likely have greater needs for healthcare. And 1 in 4 of these individuals identify as part of some sort of racial or ethnic minority group. So what does this mean? Well, there's disparities in access to healthcare. These individuals are less likely to have health insurance, which we know is a problem. They have less access to preventative services, and if they do not have these services, they're likely going to need more healthcare to deal with whatever conditions have come about. When that's the case, unfortunately, they live further from hospitals. They have increased likelihood in these rural areas to have medical staff shortages. Increased likelihood, especially recent years, of facility closures. So now, increased hindrance to access of care, further drives to get to where they need to go. But a lot of these individuals might not have reliable transportation or means to get to where they need to for their healthcare services. We also know these rural communities tend to have worse outcomes. Just a handful example of these are those living in rural communities are more likely to die at a younger age due to unintentional injuries, heart disease, respiratory disease, stroke, cancer, and even suicide. All of these, if the care and the treatments are available, could be improved upon. Obesity and diabetes rates are higher in these areas. Maternal health outcomes are worse, including the presence of higher pregnancy-related mortality. Finally, nearly a third of adults in rural communities live with some sort of disability, compared to less than 25% of individuals or adults in other communities. So here's my call to action. What can you do and what can you do now? Reach out to your politicians. Ask them for support. Here's just a couple bills right now that you could communicate with them about. HR 2480, Optimizing Postpartum Outcomes Act. It talks about and can address some of what I just mentioned regarding outcomes. What this bill will seek to do is require CMS to issue guidance on prenatal and postpartum pelvic health physical therapy under Medicaid. It's going to order the Government Accountability Office to identify and report to Congress on gaps in coverage for pelvic health physical therapy and other related services for postpartum women. It's going to instruct the CDC to educate providers and postpartum women on the importance and availability of pelvic health physical therapy. PT Compact. This is the SHARE Act, HR 1310. This would ensure that the federal background checks are completed so PTs can provide critical therapy in multiple states. This makes it easier for therapists to go from state to state into some of those rural areas across borders to provide treatments for medically underserved individuals. This bipartisan bill is already co-sponsored by 18 members of Congress. Get out there, do what you can to get that to be passed. And fortunately, it's as easy as sending a letter from the Legislative Action Center Advocacy app directly to your local representatives. Here's a website you can click on, join this, and it becomes an easy process for you. What else can you do? Here's several other additional bills that are awaiting reintroduction in the 118th Congress. We've got the Physical Therapist Workforce and Patient Access Act. This is going to add PTs to the National Health Service Corps as far as student loan repayment program. So this is going to help individuals who get out there and start providing care in community health centers. We've got the Improving Seniors Timely Access Care Act, which can be very important in these rural communities. Medicare Patient Empowerment Act, which is also beneficial. Expanded Telehealth Access Act for those individuals who can't get to in-person care. Yes, it's desirable, but let's continue to make telehealth an option for them. We've got the TEAM Act, formerly known as the SMART Act. This changes some of the requirements for PTAs and direct supervision, which can maybe improve some of the access for patients. And then Treat Long COVID Act. This is going to be worked on as well later on this summer. Can we help to provide services for these individuals that need them? Think back a couple slides ago. I talked about the respiratory problems, the heart disease, the other things that are more common in rural communities. What can you do to help these individuals? Reach out to your politicians. Make sure they're supporting these acts. The other thing you can do with APTA, House of Delegates, coming up just next month, reach out to your state chapter of the APTA. Request that they support RC19, and that is the support for initiatives to improve rural health. But don't stop there. Some other things that can be done if you're an educator. Think about ways that your program can increase enrollment of students who might go back and serve rural communities, or with your current students. What can you do to educate them and increase their chances of going to rural communities, providing such needed care? And if you're a student, if you're a clinician, what are the opportunities you can seek? Identify them, look out to go provide care for these communities. There's ways that there might be better loan repayment if you work in some of these communities. Think about that, look into it, and do your part. Thank you so much. Bye-bye.